So I'm Devendra Khandait. I'm the Deputy Director and Country Lead for the State Health Systems for Bill and Melinda Gates Foundation based in Delhi. Any disease eradication initiative is such a complex phenomena that it includes different actors, right from political, social, technical, the economist perspective, the funders perspective, the implementers perspective, contextualization versus technology, all that stuff. So there were multiple moments where I felt like, oh wow, there is a deja vu moment like, oh, these are the same learnings in smallpox eradication which are there in polio eradication also. And the point which I was trying to tell was, we often don't learn enough from the history because there is overall less respect for the implementation science. And how do we start developing the respect for that important branch of science, and how do we differentiate it, what part of it and how part of it, which will essentially tell that, oh wow, somebody has developed the what, the vaccines, the technology, etc. But when you are taking those innovations at scale, there are multiple interplay of multiple actors come into play, and how there's those things interplayed with each other, that will essentially tell implementation. That is essentially the part of implementation science. And I wish if there would have been a massive documentation of the earlier part, this would have been very easy, or at least the time would have been shorter for polio eradication. So one is, let's take a comprehensive view. You cannot work in isolation. There is a merit, but there is a less merit for vertical approaches. You cannot just say, oh, I will only focus on X and Y and I will ignore the rest of the world. Now, India faces the dual burden of NCDs as well as infectious disease. So, how do you look at integrated way? So, this is one. Second is, the system is going to operate from within. So, you need a strong health system to deliver this. So, in the northern Indian states particularly, how do you ensure that the system is geared to handle both the epidemic, the infectious disease part of it as well as the NCDs part of it, along with of course the major agenda of RMNCH and all that stuff. How do you look at this together? Third is, if you have to attack any infectious disease, you should know where the problem is. And India needs to strengthen focus on disease surveillance, not of singular disease, but a comprehensive set of disease. How do we sharpen it? Because unless and until you know it better, you will not be in a position to focus it better.